and then I'll go down the line with each one of the aldermen, ask you if you have a question, if you have a follow-up. I'll go through everybody, and then I'll come back around to anybody else who wants to, thought of something else they should ask and so forth. So, Mr. Mays, could you please address the board?
Certainly, Mr. Mayor, and thank you for the opportunity to appear tonight in front of the Kingsport Board of Mayor and Aldermen. I appreciate the invitation, and thank you to the board for the opportunity to speak tonight about the order. I guess briefly, since my last presentation, or before I begin, I want to express Dr. May could not attend tonight, and he wanted me to express his regrets that he couldn't be here. And so how we arrived is, of course, we know a lot about the disease, and I'll take questions on that if you wish. I have some numbers that may interest you and the citizens of Kingsport. As of this afternoon, approximately 3 o'clock, Tennessee has 2,239 cases confirmed statewide. Total statewide tested is 27,360. We have 175 hospitalized. We have 23 deaths in the state of Tennessee, 1 in the Tri-Cities. Fortunately, 121 cases have been technically classified recovered, and in Sullivan County we currently have 14 cases. So what brought us to the order, just to refresh your memory, many of you know that we have weekly meetings with the mayors in Sullivan County, Bristol, Kingsport, and of course Bluff City, and frequent communication and meetings with the city managers on a daily basis. Last week, our situation in Sullivan County changed from cases related to travel. In other words, a case or a person confirmed with COVID had traveled to a high-risk area or international travel and returned back home to the Tri-Cities. Last week, we had our first case of community spread. And what that means is it is a case of confirmed COVID-19 in relation to no travel or travel to a high-risk area. And so at that point in time, Dr. May and the mayors, we convened a meeting and agreed that we should issue a public health order. And basically this public health order is a higher level of restriction. It does request that businesses close. It does follow CDC guidelines for social distancing. But however, it does ramp up closure of businesses, of non-essential businesses. Now, the term essential is quite important in this order. And so we've attached in the order, and I believe it's published on the city's website, certainly on Sullivan County Health Department website and City of Bristol website. We tried to scope or list an umbrella of type businesses that could remain open under the order. And that is to help with some interpretation. There's even, this is unabridged list. There's a more exhaustive list in the order that is a hyperlink to what Homeland Security has defined as essential business. And so if you go to that list, you can see it's very broad in nature. And so to help with those interpretations of what businesses are essential or non-essential in terms of public health and the order, we established a line at the Sullivan County Health Department, 279-2777, and we have staff that are taking business calls related to the order and answering their questions in terms of closure or essential and non-essential. And we've gotten many calls today, And so we're receiving good feedback from everyone. Also, that line will take calls from concerned citizens, and if it's disease related, we have RNs available to take those calls, and we're getting several hundred of those throughout the week. So that is a service that we provide that we thought was important. The mayors really wanted something out there to help and assist businesses to make a decision about closure and complying with the order. So we thought that was very important. I think probably giving that brief explanation, I think it'd be appropriate to entertain questions.
Okay.
Mr. Mayor?
Okay, thank you. Mr. Phillips, would you like to ask a question of the health director?
A lot of people ask me this or say this or see this. So, what is the difference in safer at home versus what we were already asking people to do? I think the public really kind of doesn't understand the difference.
Yeah.
Or a shutdown.
Yeah.
Or a shutdown.
Yeah. In this case, syntax means something. Words mean something. So safer at home is a less gentle than closure, mandatory closure, or restriction, or enforcement authority. Some cities, as you may know from watching national coverage, are considering doing that or doing that. And so that is not the case of this particular order. This order is a public health order, safer at home. It's to ramp up the messaging, to encourage folks for social distancing, no more gatherings of 10 or larger, but it's also asking businesses or requiring businesses to close if they're considered non-essential, and that is to discourage travel and discourage citizens being out in the community. When you have community spread, the more people, as we all know at this point, the more people you have doing non-essential services or gathering, the more likelihood your disease state is going to spread. So, and another convincing thing I believe that we all considered in this decision, which wasn't taken lightly, by the way, is a very deliberate, carefully thought out decision, is that the anecdotal data and preliminary data is showing that cities that take this proactive position have a lower incident of community spread. In other words, you are spreading this out over a longer period of time. We won't know the total effect of this for about 3 or 4 weeks as other cities have done this, but there is enough hope, there is enough preliminary data to suggest that this is appropriate action. So there are higher levels of action, certainly that the governor has, and even the health officer under Tennessee Code may have. So if I may say, this is a kinder, gentler closure that we're asking.
You have a follow-up, Alderman Phillips?
No, I'll let everybody else go, and then maybe I'll see.
Well, did I answer your question?
Yeah, I think so. I guess you're saying it's just a kinder, gentler way of more enforcing what we were already doing, but also there are certain businesses that we are asking to close now, which before we weren't doing any of it. We weren't asking anybody to necessarily close. We were just pick up at curb and stuff like that for restaurants.
Well, certainly we want to send a strong message. I mean, many people call the health department with concerns about gatherings of 10 or more for various and sundry reasons that still are ongoing. And we do know that there are businesses that are allowing that to happen. So this public order is a way to send a message to those folks in our county, Bristol, Kingsport, and Sullivan County, that this is not appropriate given our public health emergency that we're under and that our public is facing. It's unsafe, and it quite frankly, it's disrespectful to citizens that are trying to do the right thing and to businesses that are trying to do the right thing, and keep our community safe.
Thank you. Alderman Duncan?
Yeah, I've got a couple of questions, Gary. One, I'd like to have that phone number again, just to, so
Sure.
Mike could put that out. And so if you could just give that out in just a few minutes, another time. Also, are they another area similar in our size that we can see trending with, kind of have a projection of when we may peak, or are they something kind of go by that you guys kind of look at other than just kind of what we have? I mean, are there other areas that we can kind of compare to?
Absolutely, and we work closely. It's a great question. By the way, and I'll repeat it again, I hope, the number is 279-2777. And in comparison data, there are other cities that have taken very similar action. As a matter of fact, our public order is modeled much like theirs, and that is Memphis, Shelby County, and Knox County Health Department as well. And as a matter of fact, when this action was taken, we were unaware that the governor was going to take a very similar action. And if you compare the two, they're very, very similar in draft. So, yes, there are other cities and communities that we are watching very closely. We continue to seek at the state level and local level intel, if you will, from California and New York and surrounding communities, not only larger metropolitan areas, but areas that look like the Tri-Cities in Sullivan County, to understand what the impact is on their hospital systems, how their disease rates are impacted by such actions as we're taking here. So there is some comparison that indicates this action is appropriate when you have community spread. And I want to go back to that pivotal point in Sullivan County, Kingsport and Bristol, is that when we see community spread, in other words, cases not related to travel, that is a very appropriate time to take early action. Intel, comparatively speaking, tells us that if we wait until the time is right, and that is subjected to all kinds of definitions, but if you wait until the time is right, then you wait too late. So that's why we're taking this action. Did I answer your question?
I did. I was just wondering also about, like a peak. Would you estimate 2 weeks, 3 weeks? I seen tonight on the news that the state of Washington has kind of felt like they've hit their peak and kind of on their way down with some significant numbers from that direction. So I just wonder if there's any way of estimating, when we may see a peak, or just try to be cautious.
Yeah. That's a fair question and an astute question, and the answer is I could only speculate at this point as to what Kingsport or Sullivan County's peak may be. But it isn't speculation to say that our cases are going to continue to rise over the next few weeks.
Okay. Darrell, anything?
Thank you.
Okay. Alderman Adler?
Great. And this may be a question for Mr. Billingsley, but we mentioned the governor's safer at home order, and just wondering if we can talk about, are there any substantial differences between what we're issuing and what was issued by the governor? And Billingsley, that may be a question for you.
Well, as Mr. May said, we weren't aware of what the governor was going to do. So yes, it's very similar. It's very similar to the other cities in the Tennessee have done. We had a health order that we wanted to comply with. Obviously, it complies. It's effective to all of Sullivan County, and felt like that it was important for us to make a statement from the mayor and the city manager to emphasize the fact that we asking the citizens to comply with that order.
May I add to that, Jennifer? All three of us signed under our bylaws, the charter of the city manager and the mayor are required to sign if they believe there should be a declaration of an emergency. and the city attorney signed to affirm that it was legal, all the statements contained herein. And I believe on approximately, I signed at 3 o'clock our time, and it came out about an hour later, the governor's directive. So we had no way of predicting that, but I think that's the way it happened, approximately. Go ahead, Jennifer, you're still up.
Yeah, so I think my question was coming from citizens who had contacted me last night, and we're trying to sort through whether or not there were different restrictions for Kingsport than there were statewide. And so that's a question of comparing the two bills, and if we think that, or the two orders, and they're basically essentially the same. Is that what I'm hearing?
Obviously there are places where it's worse in Tennessee, Davidson County, or Nashville is, Williamson County, where there are a lot more cases. Shelby County, I know Shelby County's probably closed more businesses than even the governor has, because of the trying to get a handle over there on the other side of the state. The order that we worked on was based upon what we know now and the number of cases that we have, and as Mr. May says, it's the beginning of community spread, and we're hopefully ahead of it compared to some of the other places that aren't quite that dramatic. So, but to answer your question, the governor has ordered a lot of businesses closed, probably some more than even we had would cover, but most of the ones that are in his order are in ours also. Can't think of any else.
And I guess the question, Mike, is which one takes precedence then? So if the governor's is more restrictive, I assume it applies. If ours is more restrictive, does it apply?
Correct. Both are correct. Whatever the most restrictive is what is applicable. So the governor's executive order obviously applies to the entire state. Ours applies to Kingsport, the jurisdiction of Kingsport. So if we have something that's a little more restrictive, then it would apply.
Just to add to that, there are things within the governor's order that are not in the Sullivan County order that apply directly to cities. I guess not necessarily, but for example, playgrounds. In the governor's order, that is a requirement for us to close playgrounds in our city parks throughout the city. Unfortunately, that's something that we will begin doing tomorrow. We've done some of that already, but we'll have to continue with that tomorrow.
Important communication point. That is something that's going to happen, letting families and citizens know about that, for sure.
Absolutely.
And if I could ask one follow-up question, Mr. Mays, about testing. I've heard a lot of questions still about turnaround time on testing. Also hearing lots in the news about faster testing, fast results as little as 15 minutes. Can you speak about what the average testing time is, the turnaround time in terms of our community and our region?
Sure. And testing is confusing with all the media outlets talking about the various experimental testings and testings that are up and coming. What exists in Tennessee is really two broad classifications. We have the state lab, which would be tests, for an example, that the health department may order, or certain circumstances if we have a potential case involving a healthcare facility or a long-term care facility or a nursing home, we would probably get those done at the state lab. Most all other testing is done at the commercial lab, and as you can imagine, there's various and sundry vendors there, such as LabCorp and Quest and such. So at the state lab level, we're running around 72 hours for results, and at the private lab sector, we're running anywhere from 3 to 5 to 7 days. The testing remains. You have to go through a screening process and meet those criteria. Again, that is on our website. It is on Ballot Health System's website as well. And so we do not have, and it is a concern for us at the local level, and I would imagine statewide, that we do not have all the testing for the population that we would like to see and availability that we would like to see. And we have no time frame for when that will occur. So our testing process really hasn't changed much at all over the last 2 weeks. The new innovative test, we have not received any communication as to when the release date for that will be at the local level.
Okay, Alderman
Thank you for that
Cooper?
answer. Thank you.
Betsy?
I guess I want to piggyback on Daryl's question. I know early on they were talking about flattening the curve. That was one of our goals, so that we wouldn't stress out the hospitals. And it seems like every day there's a little bit of an uptick in numbers. They haven't gone up huge, 2 or 3 every day. Is that kind of what you expected, or have we done what we need to do is flattening the curve? Or
Yeah. Well, flattening the curve is a term I'm reluctant to use, but indeed that is the result of what we're trying to achieve. We fully anticipate to receive many more cases of COVID in Sullivan County. Currently, we have 14, if you may recall, in Sullivan County. We expect that to rise, and what this order hopefully will achieve is to allow the case spread, or the spread among our community from person to person, to actually slow that down as much as possible or minimize that. Social distancing means a lot. It meant a lot in 1918 during the pandemic flu. And as you can imagine, they didn't have technology, but they knew social distancing worked. And in many cities where they took exercises like we're doing tonight with orders of closure and social distancing, they broke the chain of spread. And that is our only tool in the toolbox to keep the numbers low. That's the most effective tool, not the only tool. And so that is what this order is doing. We're asking the public to not be complacent. We're asking our business community to help us minimize the spread of this disease in this area. So if we didn't do anything at all and went about business as normal, I think you would see a dramatic uptick, as using your words, a dramatic uptick in caseload, severity of illness, given our population, and an overwhelming input to our hospital system. And that is exactly what we're trying to avoid as much as possible. We don't want to look like these other metropolitan areas, and I know the metropolitan areas get a lot of coverage, but there are also communities like us that are having a large amount of community spread.
Do you have a follow-up, Betsy?
Yeah, let me ask, it kind of follows up with Jennifer's question about the testing. And you made a statement that's kind of concerning that, that we're not getting the testing. From who sends, is it our, I guess, where do the tests come from? The additional testing kits, or what we need to test more people? Does that come from?
Well, the test kits are the testing is a multifaceted. You have specimen collection of a patient, if you will, and then you have the backside, as we call it, capacity at the lab. So there are 2 issues, broadly speaking. So we do not have an abundance of specimen collection ability. We have the processes, and we can do it in terms of personnel, and we have plans for that. But we need those actual swabs, if you will, they're special, to collect the specimen, and then we need to process that specimen and get it to the lab, and then the lab do the analytics, and that is another capacity resource issue. So it's a multifaceted thing without getting too technical. So when I say we do not have enough tests, it's not literally test kits. It is the front side of ability to collect the specimens, and backside of the lab to do the specimens. If we all go to the doctor and they run routine lab work, right? And so if you could imagine in this metropolitan area of 998,000, if you want to do a urinalysis and you had 998 specimens of urinalysis to do, you can understand how that would backlog the lab system.
Gary, may I interject?
Sure.
When he said 998,000, he was speaking of Ballard's footprint of the number of folks they serve.
This metropolitan region. So lab capacity is one thing, lab specimen is another. And according to FEMA and the Federal Task Force, that is dramatically changing. I'm reporting to you as I stand here, that is not the reality that we have in Kingsport and Sullivan County. That could change in 2 to 3 to 4 weeks from now.
Betsy, is it good?
No, I'm good. I don't know if it matters, but I keep getting a message that Billingsley and Chris, your bandwidth is low, and I think it's causing you all to kind of break up a little bit. There's a message that comes on my computer that Billingsley's network bandwidth is low. So that
She says there's a message on her computer that says yours is running low or something.
battery.
we know it because Chris is the same way. So I'm just letting you know that. You kind of break up.
Did you hear my answer?
Yeah, I did.
Okay.
Okay.
Did I answer your question?
It's,
Okay.
Yeah.
Alderman.
Thank you.
Good news in all this. I said, it seems like, it sounds like we're kind of struggling to keep up with everything. I said, it's.
Well, I didn't mean to portray it that way. I was just trying to answer your question. So,
Thank you. Tommy's up.
Okay, I'm not gonna get real technical, but I did want to say that I appreciate the fact for the last couple of weeks, the fact that we've all gotten together, all of our leadership from our city and the other cities. They've all gotten together, and the health department, you and Dr. May, have been working very hard at trying to answer everybody's questions and keep up with it and keep us informed. And I'd just like to say that I know it's hard on everyone to keep everything sort of together at this time, but I'd just like to commend our staff and the other staffs around the region for pulling together, for working hard, and to try to get us the answers that we're all asking for. And I think y'all are doing a great job at that. And I know that I called you, and I know you're acceptable, and I'm sure that Gary's acceptable anytime that any of y'all have any specific questions. He'll be glad to entertain them, and I think we're working hard at this thing. It's new to everybody, so I think if we just sort of pull together, everybody do what the President of the United States and everybody else that has an involvement in this, if we would just attempt to do what they want us to do, I think we'll get through this thing in good shape.
Is that it?
Thank you.
Okay. Vice Mayor George?
Thank you. Thank you so much for coming and talking with us. At what point are people considered recovered? I know in certain, our numbers, when you look at Tennessee, it says there's certain numbers that have recovered. And I know we've had people here that have been, were diagnosed, like the first ones. Are they recovered, or are those people still considered patients at this point?
yeah, great question, and I would answer your question, and my answer could be possibly dated because that's changing. And Dr. May, that's a Dr. May question. But typically it is based on your symptoms of onset, and I believe it is, I would hate to answer that in a public venue because I think that answer changed today. So I would redirect that answer or question to the CDC website for technically recovered. We do, our first case in Sullivan County is marked as recovered because that is 14 days post symptoms. That was the definition or answer to your question, but I'm not sure that is today. And I apologize for not readily giving you that answer, but I know the medical side has been discussing about that very issue. So, and I'm not sure if that was discussion with state folks and local folks, but right now I would direct that answer to the CDC website.
So we will be posting, when we post our number of cases, we will start saying that the number that is recovered, so we can kind of give some people some good news too.
Well, yeah, very good, and I like that question because we are in fact retooling our website to reflect recovered numbers and cases as well. Because that is important, especially to us on the public health side, and I think it's important for the public to recognize. So that will happen, I think, very, very soon. It's a work in progress right now, and it's a priority for us. Thank you for that question.
Do you have a follow-up?
Yeah, I've got two more. The second is I'm hearing when you turn the news on is that a lot of the healthcare workers in other locations have started to test positive. Are we do we have any in this region that have tested positive? Are we waiting on tests, or do we have the test to make sure that they are healthy and safe when they're treating people? What is our local impact on that?
We do in the region have healthcare workers that have potentially been exposed to COVID, and some have tested positive for COVID. So it's a great question, and that is a part of the population we certainly want to preserve for everyone's safety and health in Kingsport and Sullivan County. So. And it's not necessarily, exposures aren't necessarily from work related, not all exposures are. But obviously healthcare workers, your public, your first responders, your police, fire, and EMS, which is important to our infrastructure, and your healthcare workers are at high risk for exposure. So they have instituted, we all have instituted, very stringent guidelines for screening and checking, alternating shifts, doing specialized shift work, segregation of duties as much as possible to minimize exposure. And again, we're learning all these procedures from the hardest hit areas and CDC guidance. And so we believe we have the best in place, the best processes in place. We're learning every day, strategizing every day how we can protect our healthcare workers and our first responders as much as possible. And it will be a work in progress until we're through with COVID-19, without a doubt.
Okay. And lastly, and this is, I'm not sure who needs to answer this, a lot of people have received letters stating they are essential. And they have asked, do I need to carry this with me when I leave the house? Do I have to have my letter that says I'm essential? You know, certain people have, some people named essential have not. Is there any guidelines on that of what we're expecting the citizens of Kingsport to do?
Right. We do not, at the health department, we're not issuing a letter, if you will. We've gotten a lot of questions like that, and or a health card type index card. We are not doing that at this point. The public health order, again, and the attachment to the public health order broadly goes over what the essential businesses are, and then there is much more. It's not exhaustive, but it is a fairly significant list defined by Homeland Security. So that is our guidelines, is the order that you have on your agenda, which is on the website, and the Homeland Security definition of essential services. So if your business, you can pull those lists up, and if your business does not fit in that category, then you're obviously non-essential and should close. But again, that is a very broad, and I would suggest and recommend that the public and business owners consult the order and also consult the Homeland Security Essential Services and Essential Business list and look and use that, because that is actually the criteria that we're using as well.
Okay. Mayor Venable and I sat in together today at the governor's conference call. Now, remember, there were 95 counties represented and several cities throughout the state, so he didn't take questions. And I could come back to this, but I want to emphasize one point that the governor emphasized, and that is he was very adamant he had not issued a shelter-in-place order. A shelter-in-place implies severe restrictions on personal individual movement. And he's trusting that Tennesseans will act in a responsible manner, and they'll only go out when they absolutely need to go out, maybe to a pharmacy or to the grocery store, but they'll continue to limit their contact with folks as much as possible, and when they do come in proximity of other people, like in the grocery store, they maintain distance, 6-foot distance. So I can come back to his remarks. Do any of the board have another question for Mr. Mays? Go ahead, Alderman Phillips.
I have two more, I guess. Then, so with this new Safer at Home, I have noticed. I'm in the construction field, and I have been to my local home improvement stores over the last few days, and it's like Black Friday out there. So are we going to be doing anything, or are there any restrictions that are coming down from the state or from a local level that are limiting anything at, our bigger retail stores like that? Or is that just on is that on myself when I go in the store, like the mayor says, to keep 6 feet away from people and just be careful?
Well, it's a great question. I mean, we hear that, excuse me, at the health department frequently. And this order and even the previous recommendations from the CDC, those gatherings are clear a violation. Now, home improvement hardware stores are part of essential business. So they meet the criteria for staying open, but they're not exempt from helping us enforce social distancing rules. And I've been out in our city as well, and I've seen some pretty significant innovations that have been quite impressive by our local businesses in the community to expedite or facilitate social distancing. So those types of businesses we reach out to and talk to their management and ask them to exercise and comply with the order as much as possible, even though the order may allow them to stay open. And I'm probably astutely aware from citizens, and we appreciate their input. And we're working with those stores' managers to help us